Hello, my name is Jack Ryan. I'm a licensed massage therapist in Sarasota, Florida, and today's video is to talk about how to release a cramp or muscle spasm or tightness in your calf muscle. So a lot of people, when they get a cramp or tightness in the calf muscle, they try to stretch it out. That's a way of lengthening the muscle. What I like to do in my clinic is to shorten a muscle using a technique called positional release therapy. It's named for what you're actually doing. You're putting the muscle in a position of comfort that lets the muscle relax. It shuts off that neurological input that's keeping that spasm or tight muscle contracted. So what you do is you put the body in a position of three-dimensional shortening, and then you let it relax. So what you have to first do is find that area of tenderness, and then just gently hold it. Typically, you want to find something that's a 5, 6, 7, 8 out of 10. And then what you want to do is you want to just monitor it as you put it in a position of comfort in 1, 2, or 3 planes. Once you palpate it again in that position of comfort and it goes to a 0, then what you need to do is you need to hold it for about 90 seconds or longer, maybe a minute and a half to 3 minutes. You'll know it releases because you'll feel relaxation, vibration, heat coming off the area, but it has to be at least 90 seconds to shut that nerve off, and sometimes it takes a little bit longer. Once you're done that release, then slowly bring the muscle back out of that shortened position and recheck the area of tenderness to make sure that it's 0. So the thing is, once you find that position of comfort, you should go down to a 0, hold it 90 seconds, and then retest it when you bring it back out, and it should be better. So what it's going to look like is first put your body in a position of comfort. So it's the calf muscle. We want to first find the area of tenderness. So for me, I palpate, and there's a spot right there, it's a knot. Okay? So what you want to do is put the body in a position of comfort. So the best way is to lay down for this technique. As you lay down, you flex the knee up, that shortens the calf muscle. And then I like to rest my heel on the other knee, that relaxes the calf muscle. Point the toes, that relaxes it even further. When I palpate again, it's a 0. So I know I have a position of comfort. And then what I'm going to do is hold this position for 90 seconds. Sometimes you may need to modify by turning the foot in or turning the foot out to get more relaxation. And again, the release can be a heat, vibration, pulsation. I'm not pushing into the muscle, I'm just keeping my finger on there so I know I have the right spot. And if I check it, it's a 0 when I palpate again. Once it's released, you slowly bring the muscle out of that position of comfort, retest, and it's a 0. So again, flex the knee, point the toe. Sometimes turning the foot in or turn out is just fine tuning to get that muscle to go to a 0 when you repalpate again. Again, if you find an area of tenderness and you have several of them through the calf, treat the most tender one first, and a lot of times all the other ones will be released by the time you do that first one, and recheck all the other ones, and it's gone. So again, instead of stretching it, put it in a position of comfort. Flex a knee, point the toe, and fine tune with either foot turn in or foot out. And that will help relax the muscle. Again, holding it for at least 90 seconds. You're going to feel much better when you do this, and it's not as aggressive having to stretch it and try to release that cramp that way. So try this positional release therapy, and let me know how it works for you.